Sense. Ask for my.
Already did.
That's good. Hey.
I didn't even. The report.
Thousand miles back. There's nothing, literally nothing. Not bringing it through Detroit.
Maybe you should.
I'd like to call the meeting to order. Item is a roll call. Dr. Harding texted, he will be here in a couple minutes.
Present.
Here,
Here. Here. Here.
do we have a quorum? Item on the list here is the adoption of the agenda. Hopefully, had a chance to review the agenda. So entertain a motion to
I'll move to.
Second.
motion in a second. Do we have any further discussion on the agenda for today? None. All those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda is the approval of the minutes. Hopefully everybody's had a chance to review the minutes in your packet from our September 17th meeting.
Mr. President?
Yes.
I would like to make a couple of quick, well, actually just one quick change to the amendments on the minutes. On page 6, section 4, where it's the discussion and vote of the food safety inspector officer, the word it's adding starts that particular section. The actual wording of that is ability to work extended hours, evenings and or weekends, travel out of town for meetings and conferences, sometimes overnight is needed. It's correct in the description of the job, but it was inadvertently transcribed differently in the minutes. And so the minutes will be retyped and that changing those few words so that it reflects exactly what the job description says.
You're recommending to remove occasionally required to from that item 4.
Yes.
Any other comments? Minutes.
Just one question, just for clarification. On the second line, of section 4, where it says weekends and, regularly required, is that also going to be eliminated or?
So the way it reads in the job description, ability to work extended hours, evenings, and or weekends, and travel out of town for meetings slash conferences, sometimes overnight, comma, as needed.
Could you say that last part one more time?
Sure. So the entirety says, quote unquote, ability to work extended hours, comma, evenings, comma, and or weekends, and travel out of town for meetings slash conferences, comma, sometimes overnight, comma, as needed.
And we're adding this to it's in the job requirements section as well as in the duties section, correct?
Yes, it's already in the job description as is. We just wanted to clarify that it was correct in the minutes.
Okay.
Thank you.
Can I move to amend the minutes to, for section 4, read, adding ability to work extended hours, evenings and or weekends, and travel out of town for meetings, conferences, sometimes overnight as needed in job requirements? Can I move to make that amendment to the minutes?
Sure. Want a motion to approve subject to that? change?
Yes, I will move to approve, subject to that change. Second.
All right, we have a motion and a second. Dr. Harding, we're discussing the minutes from our last meeting, just trying to get those approved. Any other comments on the minutes? Okay. Hearing no additional comments, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda is the board president announcements. I have no announcements for today. Next item after that, health officer's presentation and reports. Dr. Migliori.
I would just like to highlight a few things. One is that our TB team is busier than it has been in a while. Part of that is felt to be due, if you look on page 31, you'll see that we're doing more directly observed therapies, which means that either in person or by video, we're watching the individuals take their TB medications and reminding them. It's different for each individual as to what sort of help they need to remember to take their medications or which ones to take. You will see that our TB numbers compared to last year are almost double what they were. Part of that is felt to be due to more Class B people that we're seeing immigrate from many countries where TB may be endemic and may not be necessarily addressed as active TB or latent TB. And so we are seeing more Class B patients. I would also like to point out on page 30, the mobile immunization clinics have really been very busy. One story that was told was that Mishawaka High School, because Mishawaka Clinic was closed this summer because of funding, we've been trying to be extra sensitive about offering opportunities for Mishawaka residents to get immunization should they desire. Mishawaka High School had an event recently. The schedule was filled before the event started. Extra kids were added on. These are all kids that had permission from their parents to get the flu vaccine. And there were still people in line that didn't register, that weren't added on as extras. And it was sort of standing room only event. Kids just showed up. They wanted their flu shots. So they're actually made arrangements to go back and provide another round of those immunizations. But you can see from the list that the immunizations have been nearly a daily event. They don't usually go to many of these places on the weekends, but if we have an event we're associated with, we do those. But they have been really busy and we appreciate everyone's hard work. We've had, again, a lot of animal bites, communicable diseases that we have had to investigate, the required ones that are required by the state to investigate. So our team has been busy, God bless the lead testing team. They did, I think, 12 houses. They tested in August. Because we lost our courier, those samples were lost. And so they had to go back out to those 12 houses to retest, very labor intensive through no fault of anybody in the department, but it was doubling up on their work. And the environmental team is very conscientious about their work. And the lead testing group had to go back and redo all those houses. So we miss our courier, but one of the environmental team members has stepped forward and volunteered to drop off supplies. She lives in Kosciuszko County and commutes here. She's swinging by the Marshall County Health Department to drop off specimens on a Tuesday evening on her way home. She drops it off. Marshall County has it picked up every Wednesday morning at 11. So everybody's chipping in to try and do their part for services that we've lost through funding cuts. And this is just another example of people stepping up and giving extra, and we really appreciate it.
We lost our courier because of funding cuts?
Yes, the state, we used to send a courier here to pick up our lead and our quantiferon, our TB samples, and they no longer do that.
So so you're taking, somebody from the department is taking them to Marshall County and
Health Department,
Marshall County are you combining services? Is it a courier from Marshall County or?
it's a
some-
state courier that goes to Marshall County. The state cut back on the number of couriers, and Marshall County was considered sort of a central location that if you could get drive the 45 minutes there and back,
Okay,
you can
okay,
take it there to get it picked up.
okay. So there's still a courier to Indy, right? But it's not,
It's been drastically reduced. No courier to St. Joe County.
okay.
And we like to have our TB tests for the class Bs and people who either uninsured or underinsured sent to state, because the state fee for having a TB test run on blood sample is $20. If we get it done through LabCorp or Quest, it's over $50. So, for 4 months between April and July, we had 83 tests for blood TB that we had to send downstate. So you can see the cost difference and why we miss our courier, and especially the poor lead team after they went through all those houses and, spent a half a day collecting all the samples they needed. And then I think we've sent stuff down. We used to send stuff down by FedEx or Express, and it would end up in Atlanta, and then it wasn't at the right temperature, and it's been an adjustment.
Are we compensating her somehow then for doing that?
Yes, yes. We worked with the commissioners to make that work. But it is kind of her. We really appreciate that.
Back to the TB, it is trending up, but it's still well below like 2022. Anything that we need to do, or is it just?
No, part of that was because of the pandemic and travel restrictions that were placed. But again, we're seeing more class Bs now. And the other thing is we are getting people more therapy to the direct observational therapy as well. We get the medications free from Purdue, and most of the medications are like a 12-week treatment time. We also gave 82 flu shots at the Benefest on October 1st. That was the county city buildings in the first floor where it was packed with lots of vendors from the different departments in the county. And there were 82 flu shots given that day too.
I guess just out of curiosity, for the mobile clinic, whenever the mobile immunization team, are these all situations where bringing the actual vehicle over? And
Yes,
and we need the vehicle because the vehicle stores.
it's refrigerated. There's a refrigerator in
Okay,
it
the
and it keeps
vaccines.
at the proper temperature.
Okay, but they are then setting up within an event space or something,
Yes, or
or you
if it's,
can't.
if it's outside, they have like a little canopy
Okay.
and a table they can put out.
So on average, if you're doing, if the mobile team's doing an event, how much, I mean, besides the event time, how much time do they need to set up, to take down? Is it pretty flexible? Or do you always have to kind of count? It's going to take us 3 hours plus the event time between.
They're pretty efficient. I do know
Uh-huh.
that.
They're very efficient. Ashley Hellman, Director of Nursing. So actually, the mobile team does not take the MERV to every event, only
Okay.
when it is requested. Because of the time that it does take to go get it from the garage, it adds about 45 minutes on each end to utilize the MERV. And then this space is not always the exact way we need it. So a lot of times the places that we're partnering with will have space for us, and we have special insulated coolers that have temperature monitoring systems on them as well.
Okay, okay.
I
Thanks.
forgot about the part with the MERV being in the garage. If anybody knows of a great closer location to park the MERV than Riverside Garage, that'd be great.
Where is Riverside Garage?
It's out by Pinhook.
Oh, that far.
Anyway, yeah. Do you have any questions about anything else in the health officer report?
Further questions? I think we have a spotlight presentation today.
Yes, we do. We have the care unit.
Carrie?
Hello, Renata Williams, Director of Care Unit, second floor law building. I am excited to share a high-level overview of all the work that is happening in the care unit under the direction of myself and the Assistant Director, Lisa Balke. I first want to note that there is a lot of programming, community-based programming that comes out of care. Everybody's always like, how do you do this so much, so many things? But I really have to give a shout out to the amazing team that we work with. They are dedicated to their community, working in the community, and they really love the work that they do. And that it makes it that much easier to oversee a team like that. Okay, next slide, please. Here we have an overview of the care unit. All of the programs that we currently have in the community falls under these four topics. So it's either chronic disease, community health workers, lead poisoning and prevention, health promotion and education, or our maternal and child health programming. These are also some pictures just highlighting staff at various community events. Next slide, please. So first we'll talk about the chronic disease CHWs, and they're in the community promoting the health education, assurance navigation, referral to local resources. As you can see, from January to August 31st, we had 583 SNAs engaged with almost 5,000 community members across 64 events. We also this year started our blood pressure screenings. We had a couple CHWs that routinely went to a community partner site and did blood pressure screenings every month. And we focused on training all the CHWs so they would be able to do that, and then making sure we were documenting that in our REDCap system so we can pull the data. So I would say since about March, from March until now, that is where that 121 blood pressure checks have come. The most frequent needs, as you can see, has been trending the same since the conception of the program, which is really the food, transportation, health insurance, housing, and employment. Next slide, please. And this was a cool snapshot that the assistant director worked with our data analysis just to show from just this year, all of the blue dots represent an SNA that we received. We frequently would get not as much now as previously, but SNAs that are out of county. And the most we could do is if they're looking for some type of state assistance program, for example, insurance navigation, FSSA, we can help them. Other than that, we cannot, because the way the program is designed is to connect community members with resources, local resources. And of course, we don't know resources that are in Elkhart County or any other county. But what we do try to be aware of is when we go to other community events and education presentations or roundtables, sometimes there are representation from other counties. And so we do find if there's a connector for, say, Elkhart County, maybe they may have someone, if they're looking for resources, we can't help you, but here's the person that can. But oftentimes we do have to decline. Now I'm going to talk about our lead poisoning. Our lead poisoning prevention CHWs. So not to go too deep on this because I know Michaela does a good job with our whole multi-unit lead poisoning prevention team at the health department, but just want to highlight some of our CHW numbers. So in 2024, they tested 377 children at 76 events. And from January to August, we are already at 295 children through 50 events. I will say we also have a new partnership with the Babe Store that one of the CHW spearheaded. So we will also be there on Tuesday and Thursday testing children from 1 to 4. Some of our lead events we have coming up outside of the daycare testing and outreach, and that is also headed by the CHWs, and a lot of that is just all over the county. We have some CHWs, some daycares that we are aware of because the CHWs kind of hit them every year. We do have a list of daycares from the state. Obviously, we don't have enough manpower to hit every single daycare in St. Joe County, but what we do is try to create a listserv. So Michaela will send out information to those on that list about our testing events. And then the CHWs do spend some time kind of canvassing all parts of the county. And so that would mean Lakeville, New Carlisle, Mishawaka, South Bend, to try to let them know that we're here. We can come test the kids for you, leave them information. Sometimes we hear back from them, sometimes not. We do have our reoccurring ones, and then others, we are always looking for new ones too.
Renata, did you say you're at?
Is this me doing that?
No.
Oh, okay. I'm sorry, go ahead.
Did you say you're testing at a vape store?
Daycare.
Oh,
Daycare.
Okay.
Mhm. Yeah. So, the Babe Store.
Babe.
Yes,
Oh.
yes. So next to the WIC office.
That makes
Mhm.
more sense.
Yeah. Okay, and then we had our 2024 Lead Free by 3 conference and in 2024 and 2025, which was successful. That outreach also surrounded daycares to come and hear about the importance of having the kids tested and so that they can pass that information along to the parents, trying to get every angle. And this year, we also have our Lead Poisoning Prevention Week, which is going to be a test and treat event. I'll talk a little bit more about that on the looking ahead. Next slide. And the next initiative is our health promotion and education. And so we have our mental health and substance abuse health promotion specialists. And so far from January to August, she has taught 22 naloxone trainings and distributed almost 5,000 doses of naloxone. A lot of those trainings so far have been schools, all schools, high schools, middle schools, like their counselors, their administration, a lot of the libraries. And so we are also looking to do more community-based trainings. So a lot of times she will go in, she'll train the staff and provide them with Narcan just in case they need it. But we're looking ahead to doing a reoccurring training session that's open to anybody in the community. Last month, we did one of those at One Roof, and we wasn't sure how many people would attend, but she did get a few people from the community that came, listened to the presentation, and they did take some Narcan with them too.
Excuse me, Renata, is there something we can do about, we mute the online people? Yeah, I don't want to be distracted from your presentation.
Can I ask a question while we wait?
Absolutely.
Okay, I'm sure I've asked this before, but it's been probably a couple of years. Are we the only distributors of Narcan in the community? Like, we get the,
We are
are there other entities that also independently receive Narcan and are distributing it around the community?
There are a couple organizations that do receive Narcan and operate in harm reduction, absolutely. But we are the only one that received the grant because it is specifically for local health departments.
Okay.
I think in the spring I asked for approval to apply for that again. So we are the only one who. So of those, it's up to 6,000 doses. We are the one who received that. And so other organizations may get Narcan from other places. I'm not sure where, but I think we probably are the largest distributor, I would say.
Okay, okay.
Okay, and the chronic disease health promotion specialist, this just breaks down some of the classes. So we have the hypertension, nutrition, diabetes, and fall prevention. There is a pre and post survey that she does every class. And upon reviewing the data, a lot of people increase their understanding. And what we saw was like they are saying they will look at your nutrition labels, they'll monitor their salt intake, their sugar intake, do more exercising. So that was the feedback that we received from the community on that. So all self-reported, but we are pleased with that. Next slide, please. And in our MIH, the CHWs that are at the Women's Care Center, they rotate among those three locations to connect with women early in pregnancy. You can see we're hitting our target goal with that. Most of the women we see are in the first trimester, and that is designed to be able to connect with women early in pregnancy, make sure that they're supported, they have their insurance, they have an OB doctor, and then also let them know that we are here to help walk them through, answer any questions and be an additional support to them. And that so far we have seen 143 new patients. And of course, the top need has been the the health insurance and the prenatal care or OB referrals. Next slide. And so this is the same screenshot kind of the SNAs that we have received from, or the women we've worked with from January 1st to September 30th. And the same thing, if they're out of county, if it is a state service we can help them with, we will, if it's, insurance navigation or anything from FSSA. But other than that, unfortunately, we cannot. I will say our maternal infant health coordinator did a real good job of trying to have some local resources that are outside of St. Joe County. So for example, she has a list of all the WIC offices. So to at least be able to provide them with some information like that. I will say a lot of counties are looking to have something like we have, because we see them trying to come to St. Joe County to receive that. But so hopefully we'll see this type of model in other counties as well. Next slide. And our perinatal lead poisoning program also falls underneath our MIH programming. And so far from January 1st to August 36th, she's referred 36 women for lead risk assessment. Now, this program is specifically designed for pregnant women or women who have recently given birth to make sure they're educated on lead poisoning prevention hazards in the home, and that we have a whole service available that is free, where you can have your home tested and assessed before your baby comes home and starts crawling with the hand-to-mouth activity to limit exposure. And our newest initiative, I believe, so many things I think, which is Empowering Moms and Babies Through Education and Resilience, which turned 1 year in September. In the pilot, we saw 42 unique women, 7 support people, and 194 attendees across all support classes and groups. In the pilot, we had 4 classes that was geared towards the first, second, third, fourth trimester being postpartum, which grew in our this year to 13 classes that are all topic specific, so we could have more time to deep dive into each topic. And so far, we had from January to September, 89 unique moms, 22 support people, and 952 participants across all classes. I will say, after the pilot, when we did our evaluation, we projected to see 100 people, women and support, and we have already exceeded that so far. Next slide, please. And looking ahead, earlier in the year, I came before you about a graphic designer we wanted to work with to update the Give Your Baby Room to Breathe. The previous design was it wasn't as good as this. So I will say this flyer, the Test is Treat, all of the amazing design that come out of the care unit is a result of the assistant director. She is awesome. We get so many compliments on that, and I just need to give her flowers for that. So we designed this for our Safe Sleep Initiative, which kicked off in October. And so we have been distributing sleep sacks, the flyer, the QR code also links to our Safe Sleep PDF, which is a very quick read, and it breaks down the ABCs of safe sleep. It's very accessible for any reading level. So we wanted to make it fun and engaging. We are also sharing this with hospitals as well to give out to new moms. So we're really excited about that. The sleep sacks, we have a kit that's in a bag. It has a magnet, the education, and we are also distributing that through our vital workers as well. In addition to that, we have the Test and Treat that I talked about. This is during Lead Poisoning Prevention Month, that the CHWs have really had a big part in planning and distributing and promoting. There will also be some raffle items that they worked with vendors as well to secure. So we're excited about that. And then in 2026, the CHW program will be changing. So there's been a lot of changes with funding, the CDC grant being, taken back, HFI funding, and we really wanted to focus our CHW program on something that was health and wellness, really to align also with potential grants that we could apply for. So we are still in the planning phase of it, but I will say that the idea is to have the CHWs in the community and at events, the same model that we currently have, but the service that they will be offering is the health screen that includes the cholesterol, A1C, a BMI, and a blood pressure screen. After they have the results, they will give the community member what the result is, some lifestyle changes that maybe can help, make sure they have a provider and an insurance, and if there's any resources that they may need in addition to that to help them be healthier, also do that connection. So that is what the program roughly, again, we're still designing it, is going to look like. And any questions?
Any questions for Renata?
So with the Ember program, have you noticed yet any change in our maternal infant statistics?
So the data we receive from state is behind maybe about 2 years. And recently we have learned it is going to be a little bit more behind. So no, not yet, but we're very hopeful.
Wow, that's
Yeah.
too bad, right? Do we have do we still have the local group though that meets and goes over the adverse events and all of that? Like, have we seen a decrease in that at all?
The FEMUR group and the child infant mortality group too.
Yeah,
Mhm.
they haven't seen any changes yet with this whole year of.
So we review the cases of fetal or infant death, and the reasons for it kind of fluctuate. Every now and then we may see a safe sleep that is kind of trending down. We want to continue the education and make sure. But sometimes it's accessibility. Sometimes it may be something that's genetic. So it's we review all the cases. But yeah, we are a part of that, so we continue to do that.
Just
Mhm.
because I would think with the early, like what you guys are doing is so great with the early prenatal, and I would think that would affect.
Yeah, and then we do have their report. So FEMA, I will say, does release an annual report, and we take all of that in consideration when we're doing the classes. If we want to add something, if we want to mention based off of what we see in there.
Are the classes, the Ember classes, they're still being held at the Beacon, correct?
Mhm.
And that's been a good location in terms of, correct, in terms of,
Yeah, it's been a good location. That contract will be ending in December. So we're also in the evaluation phase for that. We have a survey that has went out to all the moms that attended, those who have registered but did not attend. We do have our Spanish version is online to try to minimize the interpretation. So we will be evaluating all things to see next year if it still would be at the beginning. And we are going to also have English online and what will be the best setup with that.
What about library?
That is part of the survey. We asked them about the libraries and stuff too. So before we start saying what we think is best, we really want to hear back from the moms. So in the end of this month is the deadline for the evaluation, and we're going to take that in consideration as we reshape it.
Sure.
Um, the last tour of duty I had on the health board, lead poisoning in St. Joe County was a big issue. Health department was involved, the cities of South Bend, Mishawaka. Homeowners who lived in certain zip codes were more prevalently affected by those issues. Obviously, the people that were renters or lived in homes that had a lead issue was big. And then the entire medical community got involved. And then University of Notre Dame um, allotted resources to also study the issue. So let me come back to that. The crossover program with perinatal lead poisoning, that's fantastic. The question was that a health department initiated program or was that someone else?
That was the health department. And that program honestly was very slow to take off when it first came about. But the thing about that is we've always had that service, like environmental will test anybody home as long as you have a child that spends more than 50% of their time there. That program was just to make it more accessible for people to understand, to see, like, and so we use that as a vehicle to say, hey, pregnant moms, take this assessment, and then we funnel them straight to environmental, same as it will be anyway.
In your numbers, you indicated 194 from September to December of 2024 and 42 unique. What is the definition of unique?
Okay, so unique is the one person that may attend all 13 classes. So we don't count that person 13 times. We do in the total attendees, but that we break it down for the unique person. Does that make sense?
Okay. And so this year you have 89 unique, and then you have a unique support
Mhm.
group.
Yes, so that could be the father, the mother, the sister, whoever their support person is, but same thing, we only count them one time. They may continue to come to the class multiple times with them because we have multiple topics, but when we count unique, we only count them once.
A couple months ago, I had a chance to visit with Dr. McGlory about issues in the community. And from your perspective, won't hold you to this, but how big is the present lead problem issue in St. Joe County? Are we addressing it? Are we behind the table in terms of getting after certain things that we need to do, or what needs to be done to rectify or to eliminate lead issues in St. Joe County? And I just am curious, as the leading practitioner here, what your sense of, and we won't hold you to this, but
Yeah.
what's your sense of where we are today? How large of an issue is lead poisoning or lead an issue in St. Joe County?
Yeah, so that's a big question. I will say, one, I think we're doing a good job with it, with creating awareness and education about it. But also, lead is always going to be an issue in St. Joe County just because the percentage of homes that we have built before 1978 and the condition of those homes. And even homes that are in good condition, if you don't keep up with it, things deteriorate. Paint starts to break down, even the layers of it. And that's what creates the dust that a lot of kids are exposed to. That and also the soil. So we're never going to be able to eliminate it. But the best thing we can do is to make sure that the community is aware of it, how to prevent your child from being exposed to it, and that we have resources to help you with that.
For me personally, that's a large issue because it was identified as a major, having a major impact a number of years ago. And I would hate to think that given the time it has gone on, the health department has done immense work. I know this for a fact, but what other partners, I mentioned Notre Dame, are they still involved? Are they not involved? What other partners should be concerned about this that either are at the table now, or we need to get back to the table to rectify and eliminate this? Because this is eliminatable. This can happen, but not by the single efforts of the health department. That we learned from years ago. It
Yeah,
takes-
we do a lot of collaboration. So and my part in it is a small collaboration of everybody, which we make one whole at the health department. But we do have the Northwest side that we collaborate. They have a whole lead affinity group. We are part of that. There's a lot of different environmental agencies that also attend that. Notre Dame as well. Our partnership at the Babe Store, Notre Dame is also there with their testing kits. The city of South Bend is also there during the same time, promoting the grant that they have. So I think that there is a lot of cross collaboration. Michaela, which is the lead coordinator, does a lot of education to providers' offices as well in terms of the law with lead testing and the regulation. And we also have parents to make sure that they are aware of the seriousness of elevated lead levels, because it doesn't present like a cough or a cold or a fever. And a lot of times if the lead level is too high, then it has irreversible health effects. So I do think that there's a good job collectively. I think Notre Dame and their testing kit is an awesome service. However, we do have licensed lead risk assessors that we want to make sure that we're also, promoting that. So there's a way that we all can work together.
I would be interested in your recommendations to the board in terms of what we can do to support your efforts to eliminate lead in St. Joe County.
Absolutely. I will take that back to the lead team for our next meeting.
Thank you very much.
Yeah.
And just as a follow-up, the state of Indiana passed a law that went into effect, I believe, January 1st, 2021, requiring all children by the time they're between like their 12 to 15-month-old visit to have a lead test documented. So that's available in the state database, the vaccine database called CHIRP. So that's required, a requirement. The other thing is our public health nurses also help with the management of some of the lead, and the CHW do as well. Lead management for kids that are elevated, we get those reports back from the state, and we do follow up with parents on the phone to make sure that they're getting the testing that's needed.
Do we get any, the data that you receive back, are you seeing any trends or some?
We're just trying to get those numbers down. So kids that are really elevated, we try to, tell them about things to watch for, send out the environmental health team to do a lead assessment of their house. The city of South Bend, if you live within city limits, has grants to help with remediation as well. So there is a lot of collaboration, but there's also the state law that requires we test all these kids during that, first 12 to 15 months of life.
So,
Go ahead.
sorry.
So I was curious, if you got the data, I just wondered if data is showing that we're making some positive progress over the years since whatever 2021 or not.
Let me ask Breezy. Breezy is our interim Department of Health, Environmental Health Services Director, and she's also a lead guru. So
Oh, that's fun.
And it's okay if we don't know. I mean, we don't have to make it up.
So I'll say two things. One, the rates kind of ebb and flow. So after COVID, we saw a stark decrease in the amount of children that were being tested. For years, it was about 10 to 12% of children that should have been tested for lead were actively being tested for lead. Like Dr. mentioned with that law, we had a lot more children being tested. I would say the rates of children coming back elevated is kind of the same. I can't give you like an exact number, but I'd be happy to look into that for our unit spotlight next month. But we also see trends geographically. So for example, the zip code 46613, so this would be right behind Riley High School, that is constantly our number one for the amount of children with identified lead poisoning. But that can be tricky because we don't have a number of how many children live in that zip code. So if we were to do like a rate for each zip code, it might show a different result, but we just consistently see that that zip code has a high number of children with lead poisoning, which is kind of surprising because it's quite small. If you look at a map of all the zip codes, you would think it would be 46628 because it's geographically quite large, but it's typically 46613 that comes back with a lot of elevated children.
Do we have any like previous business that was in that area that had contaminated the soil though?
No, so my thought process over the years, and this is just anecdotally, is that most of the houses in that neighborhood are rentals. They're not owner occupied. And so sometimes you see with owner occupied homes, they are kept up on. I'm not trying to accuse anybody of anything, but sometimes if you have houses that have sat and had tenant after tenant just flushed in and flushed out, those repairs aren't made as frequently. And so you'll have windows that are original still. It's also, I think, a geographic thing because the houses are so close together. So the acreage of each lot is much smaller. So the paint that was involved in the construction of each house trickles into the soil and sticks there a lot longer because there's nowhere for it to kind of flush out to. So that would be my guess. But that's not.
I just didn't know if
Yeah.
you knew of like because there was a lot of
No,
industrial. things
Yeah,
that
and that
happened in our
neighborhood
area.
has been residential for a very, very, very long time. I know that, oh gosh, I can't think of her name, but she was involved with Lead Affinity for a long time. And Monica Tetzlaff, she teaches at IUSB, and she had a class do a study, and they created a map of all the leaded industries in the county. So I'd be happy to pull that out. And again, I can show that in next month's unit
It'd be
spotlight.
interesting to see if it correlates, only because that's
Yeah.
that's harder to remediate because
Right.
it's in the soil.
Yeah,
so.
definitely much more challenging.
Any other questions from the board?
With regard to lead, I was just curious, some of those areas, like 46613, is an example. They have in-home, when you have like an in-home daycare in one of these older homes, do you really target kind of offering your services?
Yes, so Amelia Lazinski is our other licensed lead risk assessor in the environmental health unit. She has done a phenomenal job in the last 2 years. Her and the CHWs have been working extensively with daycares to do testing of children and testing of the home if it was built before 1978. So she definitely pairs with the care unit in that way, and we've tested several in-home daycares.
Okay.
And if they do come back positive, we're able to kind of point them to resources on what they can do with that.
Okay.
Mhm.
Oh, would an in-home daycare be eligible for some of these grants too?
I don't believe so. So we did work with the city of South Bend because if it's considered, in-home daycares are kind of in this weird like middle ground where
Okay.
they're not commercial or residential. They're like this weird
Mhm.
third thing that doesn't have a name. And so that I believe the city said they had to look into it, but they didn't think so. But I don't want to go on the record and say that. I can certainly confirm that. But I believe when they came to our lead poisoning prevention event, it was not something they were able to do,
Okay.
but I can look into
And
that.
we don't have any, there's nothing that correlates with the building department for code enforcement for,
As far as lead is
required-
concerned?
right.
Yes, no, so that would be local health departments or the state of Indiana, but not the building department. I believe also, though, if you're a licensed daycare, they have their own rules because you're considered a child occupied facility. And you can't, I don't believe you can't operate if you have record of there being lead poisoning there. So we do work with the state when needed to make sure that all that gets configured.
But there's no laws on upkeep of homes that are built prior.
That's a great question, and I do not have an answer, but I think that's a great thought. Yeah,
That's probably the only way to
yeah.
fix it.
Well, this is kind of where things, I wouldn't say got dropped a number of years ago, but it's like any other important issue. There's no doubt that the health department is doing all they can to address this, and without question, will continue to do so. The issue is so large and it's somewhat political because you're dealing with people that have a vested interest in a home
Mhm.
that maybe they will or they will not reinvest to make it safe. And unsuspecting young couples with children or whatever
Mhm.
usually move in at the lowest rent level and work their way up the ladder in terms of their kids. But it's a multifaceted problem that needs the attention of everyone in the community in order to solve it. It can't be just the medical community or the health department. It's got to be the homeowners group. It's got
Yeah,
to be
so
building and grounds or
Yeah.
code enforcement.
absolutely. And we
And-
do work with code enforcement. They actually have an RSVP program. So if they notice deteriorated paint in a house, and this is just for the city of South Bend. So if it falls within the city limits, if they notice deteriorated paint and they know the house was built before 1978, they are required to abate that. Whether it tests positive or negative, it's just their form of prevention. I also was working with a local landlord who is part of a landlord group, and he wants me to come speak about lead, but we started organizing that when I was 39 and a half weeks pregnant. So that was not on my radar at the time, but it is now. So I'm going to reconnect with him so that I can speak with local landlords. And we've done a lot of talks with realtors and people, because in my opinion, it starts in the home. So that's where we have to kind of start. And it is tricky and it's expensive, but we can at least, like Renata said, educate the community on testing their children, testing their homes, and small things they can do to prevent exposure. So I definitely agree with what you're saying.
So I can say in real estate, any home that is purchased prior to 1978, a lead-based paint disclosure form is required.
Yes.
However, I would say probably 9.9 out of 10 times, the seller of that home doesn't really have a lot of knowledge about lead-based paint in the home. And so they're basically disclosing they don't know anything.
Right.
And a buyer is going to say, okay. I mean, so there's not a lot of knowledge that's passed along. So,
And if you haven't had a formal inspection done, you're kind of able to just say, well, I don't know if there's lead. And so that's what a lot of people do. So, and again, if I didn't know about lead, if I didn't before I worked here, I don't know. I lived in a house that was old when I was in college and I had no idea. So maybe I signed that I understood, but in that pack they give you when you sign a lease or you purchase a home, it's just 1 out of 9,000 signatures. So it's definitely our goal to educate enough that it's something when people see the word lead, they go, oh, I saw something about that. I remember the health department had this event or this piece or whatever, and they think about it a little more in depth. So.
Okay, thank you. Any-
Well, I would just ask that the group that you have that are working on this issue, if they have recommendations or ideas or suggestions, filter back through you. If there are people that we need to reach out to or get more involved in this topic again, I'm somewhat disappointed it's still a topic in St. Joe County. After all the resources that got poured into it a number of years ago, which just tells me it wasn't important enough at the time, but it's still here and it's affecting young women and young kids. And that should not be happening in 2025.
I feel like you have to have a political change there.
Yeah,
though.
yeah.
There has to be a law made that it's required to mediate and change, and it's not gonna happen otherwise because a lot of the rental homes in our area are owned by a few people.
Exactly.
And and you know what, money is the root of all evil, and that's part of it, where they don't want to spend the money on that, and they don't. So it'd require a higher level in even our county to fix that.
Yeah.
Just make them do it. So maybe that's something we can start pushing on people, but
You heard it here, political uprising happening.
it's what it takes sometimes.
I look forward to hearing more from you next month, so
Thank you.
thank you for that. Renata, anything else you want to close on or add?
Sorry.
No, unless you have anything else for me.
Anything else for Renata? Go.
I did want to ask more about the changes that you're planning on, but it sounds like they might be related to one of the grants that
Uh-huh.
were, okay. So I did want to ask one thing about chronic disease.
Mhm.
The classes, where are you hosting them? And
A little bit of everywhere. So
Okay.
just like with the CHWs, they normally come back to the health promotion specialist and be like, hey, we have this group. They meet every Monday. They're interested, or I think this would be a good place. We originally was piggybacking a lot off of Real Services, who has a lot of different areas all around the county. And so, yeah, a little bit of everywhere, but a lot of community centers, libraries. I think one of the Real Services was in a church or somewhere outer in the county, so, but a little bit everywhere.
are these focused more on older residents
Yeah,
or?
so that's just how it panned out. It was
Okay.
not, it was supposed to be for everybody. And in fact, one of the goals was like, how can we see a younger audience? But with the Real Services and the fall prevention, we just happen to see that demographic. But now we have been in contact with a few groups that has given us a younger demographic that meets monthly. And so she's been engaging with them too.
And we're promoting all of these classes, how?
So we have them on our website. She also does a lot of canvassing like the CHWs do, like everybody in the unit is community based. So she has flyers and she goes out to different organizations and different spots and community centers around the county to talk to whomever and let them know we have this service and to
What about, like,
contact her.
Social media.
Yeah, on social media, we have it on our website too. Mhm.
All right. Well, Renata, thank you for your leadership there, and
Thank you.
Alyssa, you also. And please pass along our thanks to your whole group. I'll read one more time about, I went to the Ember thing, celebration last month, and it was just the alumni of the program and the participants just raved about what they learned and the health department's efforts. And I was surprised, what surprised me is it's not just the physical element issues, but also the mental support that they got there. It's just, they were just gushing about it. So it's a great program. And I like your graphics too. And test and treat, that's brilliant. Whoever came up with that. Good job. Anything else on this topic? If not, we need a motion to approve the health officer's report.
I will so move.
Second.
Motion is second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, new business, item 2539, discussion and vote, organizational chart. Migliore.
You will find the organizational chart that we are referencing on page 48, or excuse me, 49. Because of restructuring the health department back in the summer after HFI funding cuts and elimination of several positions, we needed to basically just trim up the organizational chart. There's not any major changes here, but we brought the each of the units. You guys are the boss. You see that at the top. And then from there, you see the 5 different units that we have from left to right: care, environmental health, foods, nursing, and vital records. And then each arm for each unit and the number of employees. Again, it was eliminating our HFI coordinator, communication specialists, emergency preparedness coordinator. Those positions were eliminated.
And just to be clear, we also have this care unit structure. Is that just part of the presentation
That's
packet?
part of the
So
presentation.
We're not, that's not something that we're addressing.
No.
Okay.
That's just to show you who makes up the care unit.
Yes. Okay.
So this org chart, is this just for our internal use, or does this isn't anything that goes to the council or anything?
No, this is just internal use, and it's really just more of a paperwork thing than it is. There's no major changes. There's other than elimination of positions.
Any other questions for Dr. Migliore? Or if not, entertain a motion to, we need a motion to approve this, is that? Yeah. Entertain a motion to approve the new organizational chart.
I make a motion to approve item 2539, the organizational chart.
Second.
Thank you. We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item, 2540, discussion and vote, billing consultant proposal, request.
Yes, and I have a request that we table that respectfully. The consultant is a national consultant and is still working on finding dates to get together so that she can figure out what the timeline is going to be. They're still working through looking at the insurances that we take through the nursing division. So if we could table that for now, we'd be appreciative of that.
I move to table 2540 until next month.
Second.
We have a motion and a second to table. Any further discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. It's tabled. Item 2541, discussion and vote, 2026 Board of Health meeting schedule. Everybody has, hopefully saw that in their packet.
Page 51, if you're looking for it.
51, thanks for the page numbers.
Hmm.
Any comments, any concerns? If not, entertain a motion to approve our schedule for next year.
I make a motion to approve our schedule for next year.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, under grant requests, item 2542, discussion and vote to receive Anthem 10 $50 gift cards for the prenatal lead screening program.
Yes, Renata Williams, Director of Care, second floor lot building. So there was $500 gift cards donated from Anthem, their Walmart gift cards. This came about through their community action person that the prenatal lead poisoning prevention program director connected with her at an event, and she let her know that they would donate those gift cards, which they have. Anthem has a stake in lead poisoning prevention from their insurance side. When I was in Michaela's position, they would often call to follow up, the same as we do in terms of case management regarding children who have elevated lead levels. So we would work together to see, like, if they're still at this address, do you have a new phone number for them to you. They would give us test results if they had something that we didn't have for whatever reason and vice versa. So they want to make sure that, again, with our initiative, making sure that the home is checked before the child is even born, they were able to get behind that.
Sounds great. Question for Renata. I'll entertain a motion.
I motion to approve item 2542, the Anthem gift cards.
Second.
Motion and a second. Any further discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2543, discussion and vote. I think this is to apply. Is
It
it?
is to apply,
It is
correct.
To apply for SIA Foundation something.
Yeah, so this grant is for the equipment. And when I told you the CHW program is changing to more of a wellness. And so the instruments that we want to use to be able to do the health screening out in the field in the community are Abbott, which is a high quality instrument. I have a background in laboratory 18 years before I switched to public health. And so the $15,000 grant is up to $15,000. So we're applying for the full $15,000. Actually, the amount that for all of the equipment is a little bit over $15,000 to be able to purchase the equipment to do the health screenings in the community. So we're hoping to do at least 500 screenings in the pilot in the first year. With the caveat is that we have less CHWs dedicated to this program as we had previously. So a lot of the CHWs, the way we structured with lead and MIH and moving, people around to make sure things are covered, we'll have probably about 3.5 CHWs dedicated to just this program. And so that's another reason why we're not focusing so much on the resource connection. We do have the connections. We know a lot of what organizations can do what, so we will provide that information to them. But how the program is designed now, we do a lot of follow-up. Did you get the resource? Did you call them? Do you have an appointment? Did you have everything you need? Is there anything else you need? We won't be able to do that. So it will be really services up front. The health screening, the health education. Do you have a provider? If your A1C was elevated, have you seen your provider? When is the last time? Make sure that you are connected to a provider and you have a health insurance. Same with the blood pressure screenings that they already do now. We already have a structure. If it is extremely elevated, hypertensive crisis, all of the things, but they will be educated from the manufacturer on how to do the health screenings in the field. We also have both physicians that is going to help with the training. And a lot of the things that we're doing is the screening and lifestyle changes. And this is what it means for you. And then providing resources if needed, but not continuing to follow up because again, only 3.5 people can only do so much.
I just want to add that the testing that we're doing would be a lipid panel, which would be a total cholesterol, LDL cholesterol, which is the bad cholesterol, HDL cholesterol, which is the good cholesterol, and then it would give you a ratio of your risk for having consequences of an elevated cholesterol, which is heart attack, stroke, peripheral vascular disease, anywhere where you might get a clogged artery. The hemoglobin A1C, or A1C for short, is a screening test for diabetes or prediabetes. And basically that gives us your average blood sugar in the previous 10 to 12 weeks. So even if you ate a Dairy Queen that night before, it's not going to affect that A1C. Because it's based on the average of your blood sugars. But it gives us an idea of whether somebody may be pre-diabetic or diabetic, to give them information about how that can be addressed. The cholesterol, if they have an elevated cholesterol or low HDL or high LDL, we give them educational information about that. Blood pressure, we're already doing. BMI is body mass index. It's not a perfect way of assessing someone's level of obesity, but it is a way where you can get the person's height and weight and give them an idea of their percentage of body fat. Again, it's not perfect, but it's a way that the CHWs can give you some sort of guidance so that can perhaps motivate you or inform you of how you can adjust that. For most people, it would be adjusting it downward. low-fat diet. And so we would give you dietary information, but also encourage you to follow up with that information to discuss with your provider. And we would have information about all of those parameters and what those numbers mean. And certainly if we find somebody has a horrible A1C, is sky high, we would have a parameter where we say you need to seek medical care, similar to our blood pressure parameters that we have too.
When you're doing the education on what to do for people with have abnormal levels, where does that come from? Like what kind of guidelines are being followed for that?
So either like like the American Academy of Family Practitioners or AAP. We probably wouldn't use many with kids, but in terms of guidelines we try to use either societal guidelines or the CDC. Those are our 3 measurements that we use for information.
And we are still building it out. So that part we haven't.
No
like-
wiki, no wiki.
Mhm.
And dietary
Mhm.
recommendations? Like where do the dietary recommendations?
Dietary with the American Diabetic Association, ADA.
So the tests themselves, are these the CHWs themselves will do the testing?
Yeah, so it's a finger prick to a cartridge, you put it in a machine and it reads it off and you give them their result based on the instrument's reference range.
Okay, so is this for all the tests or is that?
So the cholesterol
Uh-huh.
and the A1C, it is. Those are 2 different tests
Okay.
on 2 different instruments from the one finger poke. Hopefully they bleed well. And then the BMI and the blood pressure is, separate, but
Okay.
all part of the screening.
And these are the tests that you can actually get over the counter. They're direct to consumer testings that you can do at home, prick your finger and submit the sample to.
But these would have, so are these disposable tests or are these?
Mhm.
They're disposable cartridges, plastic
Oh.
cartridges that fit into the machine. The machine gets you the information within 5 minutes.
Okay, so what you're planning to is buy the machines for these?
And the cartridges.
Okay,
So the cartridges run, relatively speaking, depending on what kind of price you can get, relatively speaking, about $10 each.
okay. So how many, with this amount of money that we're asking for, is that just to buy the machines or do we get, how many cartridges are we?
Is to buy the machines and some of the cartridges, like the machine, some of it, as a new purchase, it comes with a bundle deal. So you do
Okay.
get some of the cartridges when you buy the machine, and then supplemental, we would have to buy more.
Do we, how would maybe the funding going forward, would that be a significant expense, do you think? Is that something that?
It's
I don't-
something that's built into some of our HFI funding. that
Okay,
We've saved to earmark for this kind of project.
okay. And I forgot did you say how many people you said you hope to serve, like 500?
Yeah, we hope to serve at least 500 directly with the testing, but in hopes to double that if you get that education and that information and you implement that lifestyle change, and that's also going to affect your household. So if that's the mother or the father or the person who's buying the groceries or preparing the meals type of thing.
Okay, so, but these things, would they be at like a health fair where?
So when integrating it to the same way we operate right now. So the CHWs are already in the communities during the week at different community centers at different places, offering the insurance navigation and the resource connection. It would be the same thing, but instead of that service, it would be a health screen. So we also hope that it will open us up to other places to also be where maybe they were like, oh, I don't know about that, but it's now a free health screen service that they would do. But then also, yes, at the health fairs too, or any other community events, when they call on us, we would say we could attend and provide these health screenings.
Is it, or of these 4, it sounds like the cholesterol and the A1C have the cartridges. So
Correct.
that would be $10 a pop. But blood pressure and BMI, are those?
Free.
So that's like the blood pressure cuff. You do the initial investment, you get the materials and then, okay, so.
We're not
those-
charging for those.
No,
We're not gonna
it's free.
charge $10, like,
Yeah,
that wouldn't be something that you would
No.
maybe want to throw into our thing that we do.
Well, no, because that is considered like the incentive. So a lot of the programs, we try to incentivize in a way to get people to come. So like for Ember, we do give Pampers, we do raffle items. So the free screening is kind of considered the incentive. So like if you come to us, you get this free service.
I mean,
Right.
oh,
Go ahead.
oh, I was just
No,
gonna
keep
say, it seems, it seems like a fantastic idea to have testing to make these kind of health screens easily accessible to people who otherwise might not even think about it. I guess I'm just realizing that for 2 of these tests, we have to also build in that cost aspect. Like, it's just that tension, that balance between a tight budget, but also wanting to allow for people who could benefit from this to get the screening. I mean, it's good though to know that, I mean, I know we're already doing blood pressure, but BMI, we have those services that we can kind of offer.
And we do have a whole budget for the chronic disease program. And so that's what we're going to
Oh.
use for that.
Okay.
Our chronic conditions that the CHWs fall underneath that, and so does the health promotion specialist. So we do have a budget for chronic conditions specifically.
Oh, so this would, wait, is this one of our, a separate, just within the chronic disease?
Yeah,
budget.
within our HFI budget. So we have MIH, we have chronic conditions. So I'm saying we do have funds allowed it to this.
Okay,
Yeah,
well, that's very good.
yeah.
Thank you.
Dr. Harding?
Is SIA Foundation someone that we've done business with before?
No, this is a new grant opportunity from the Subaru Foundation, and their foundation helps to fund projects, maximum $15,000, to improve the quality of life and meet the needs of Indiana residents in the areas of arts, culture, education, health, and welfare.
That's the next point I was going to make. Might be a good opportunity to keep exploring arts, culture, education grants, and involving our partners with schools and all kinds of other things that are possibilities, but didn't know if they were only designating on one item. So it'd be a good opportunity to get other people involved that also need money and can do some unique things. So
Right, right, absolutely.
Subaru is the company then.
The
The
cars,
car
right?
company, yeah.
Mhm.
Yeah, okay.
All right, thank you. Any other
How-
questions?
How many actual cartridges do you anticipate receiving for if you get the full amount?
I don't remember. I'll have to get that back to you when we broke down the budget
Just
lines.
wondering like when will we actually have to start putting other money in? Because it seems like you'd get a lot of them, because I know I'm familiar with those machines and they're not $15,000. So it's a lot.
Right.
Yeah, no, the machines I think was 3 to 4. We also got maybe a little discount a piece, but then we had to buy 2. So this is for 2 of the cholesterol machines, 2 of the A1C machines.
Oh, they're not in one? They're
No.
not, oh.
Mm-mm.
They don't make one that
Does-
has everything,
Yeah.
like a Cepheid or something. They don't do that.
Thank you. Any other questions for Dr. McGleary or Renata? This item. If not, I'll entertain a motion.
I motion to approve the SIA Foundation item 2543.
But this says receive and we're
It's
not
apply.
receiving.
Yeah,
It's
it's apply.
apply. Yeah. Second,
Motion and a second. Any further discussion to apply for this grant? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. We have no old business. Next item on the agenda is public comment. Jenny, do we have anybody signed up? Okay. Next item on the agenda is our time and place of our next regular meeting, November 19th, 4:30, fourth floor right here. With that, we are adjourned.
Thank you very much for your time.
Thank you.
Thank you.